Hi everyone, my name is Dr. Robert Chen. I welcome you to our brief teaching video entitled 5 Lives in 5 Minutes. This video will introduce you to the diagnostic and management of 5 common scenario clinical conditions presenting with bradycardia coupled with hypotension. Bradycardia and hypotension. Typically, baroreceptors in the carotid arteries and aorta respond to hypotension by increasing sympathetic outflow, thus increasing heart rate and contractility. A reverse response is said to occur when a patient has bradycardia and hypotension. The following 5 cases represent common causes of bradycardia and hypotension. Our first case is a 65-year-old male presenting with chest pain. As you can see from the EKG here, there are ST elevation in the inferior lead 2, 3, and AVF, as well as some reciprocal depression in the precordial lead here. The heart rate is in the 30s, and there are no obvious P waves, suggesting a high junctional escape rhythm. Myocardial infarction with heart block can result from ischemia to the AV node or from the vasogeric reflex, increased vagal tone due to ischemia. As shown here, again, there are a lack of P waves. Treatment in this scenario is aimed at restoring preload and the timely cardiac catheterization coupled with antiplatelet agent. Supportive care with vasopressors or pacing may be necessary. Please avoid nitrate, beta blocker, or opioid because they will make the shock worse. Our next case involves a 24-year-old patient presenting with neck pain and paraplegia after a fall. As you can see above me now here, there is a spinal cord injury, and this type can cause loss of sympathetic tone, bleeding, or hypotension and bradycardia. This is called neurogenic shock and is different than spinal shock, which is simply a reflexia that is may occur after cold injury. Treatment of neurogenic shock centers of protecting the airway, breathing, and circulation, and the timely surgical intervention. The next patient whose EKG we'll view is a 66-year-old female who has been out of her thyroid medication. As you can see here, she has a low voltage EKG with extreme bradycardia. The history and the EKG are strongly suggest a myxedemous coma. Myxedema coma, like neurogenic shock, involves loss of sympathetic tone. Also, myxedema stems from low thyroxine levels, which in turn reduces inotrope and chronotropy. Importantly, treatment of myxedema should involve both replacement of levothyroxine and corticosteroid to avoid adrenal crisis. It is the middle of winter when our next patient arrives, a skier found with a core body temperature of 30 degrees Celsius. Our EKG can see right above me the classic Osborne wave, which is a second upward inflation following the QRS complex and before P waves. Hypothermic patients presenting with bradycardia and hypotension are characterized as mild, moderate, and severe. In moderate and severe cases of bradycardia, decrease inotrope may be noted. The Osborn wave, also called J wave, is proportional to the degree of hypothermia, and treatment centered on rewarming while avoiding external rewarming measures that may worsen shock through peripheral vasodilation. Our last patient of the day is a 45-year-old person who unfortunately was found unconscious next to an empty pill bottle. On EKG, we noticed profound bradycardia coupled with a lack of decreasable P waves. AV nodal blocker overdose presenting a sinus bradycardia or any degree of AV block. A prolonged PR is an early sign of AV nodal block toxicity. Treatment for this patient involves giving them antidotes such as glucagon, or which activates adrenal cyclicase and exerts an inotropic and chronotropic effect. Calcium and vasopressor may be also employed to support the cardiac function. Some patients end up needing internal or transvenous pacing as well. In conclusion, while we have not exhaustively detailed all causes of bradycardia and hypotension, such as acidosis, hypoglycemia, and electrolyte and adrenal abnormalities, we have covered a big five shown colorfully here to my right, in the hope that we will remain mindful of this when you encounter the reverse response. Thank you for your attention and time. Bye-bye.